Welcome to Social Work Live at Columbia School of Social Work. My name is Michael Friedman. I teach health policy and mental health policy here at the school. Each week we interview a member of our community to discuss the latest in social work practice. After 15 minutes we will open up for discussion and for your questions, which you can post in the comments section. Today our guest is Amy Werman. Amy teaches research here at Columbia and has a great interest in wilderness therapy, which is something about which I know absolutely nothing. So my first question to you is, what is wilderness therapy?
You know, I had a hunch you were going to ask me that. So since the definition is a little bit unwieldy, I'm going to read it. So wilderness therapy is a treatment modality that uses expeditions into the wilderness or unfamiliar surroundings as a means of addressing behavioral and mental health issues.
Okay, that gets us started. Can you tell us a little bit about it? Give us an example?
Sure. I can actually speak in the first person since I have participated in wilderness therapy missions, particularly in Israel. And so the basic premise is that you take a group of, usually it's youth at risk, although wilderness therapy has been shown to be an evidence-based practice for many different populations and a variety of different behavioral and emotional issues. And you go out into some kind of sort of novel environment. In my case, I was in the middle of the desert in Israel. And during that time, you're obviously disconnected from all kinds of stimuli and distractions. And you go through a series of very physical activities, whether it's hiking 18 miles a day, going up mountains, down mountains. And the point is that these activities are calculated challenges. So when you get into the wilderness, you feel like, I'm never going to be able to do this. And through going through the program day by day and having to rely on yourself to build fires, to stay warm, to stay protected from the rain, you develop a sense of sort of self-efficacy and self-esteem.
Who are the people who go into these programs for the therapy?
So these are individuals, and again, the biggest population that goes in are youth, oftentimes in the juvenile justice system.
Teenagers.
Yeah, youth at risk. And that's where most of the literature is. And so they can be going in for issues because of drug addiction, conduct disorder behavior, all kinds of family issues. And they're going into wilderness usually because they've not had success in traditional therapeutic milieus. For instance, outpatient, once a week therapy.
So this is different from traditional outpatient therapy, obviously. Can you comment on some of the ways in which it's different? Obviously, going out into the wilderness is different from going into an office and sitting and having a conversation or doing cognitive therapy or whatever, but I just wonder if you could comment on what some of these differences are.
So I liken it to, as someone who has straddled both spheres, I have a private practice, clinical practice, and I also have been on wilderness. Wilderness is private practice on steroids. So everything is happening in real time. So if a child or a teenager goes into wilderness, it's not just that they're being seen for 45 minutes and they can present however they want. You know, we all know, those of us who have been through therapy, you can present yourself and you can hold back and hide, and the therapist never knows what you're like or how you interact in the real world. But when you are in wilderness, usually it's in small groups, and it's facilitated by professional mental health workers. Everything you do is grist for the mill. Every interaction you have with one of your peers, it's grist for the mill. And when I say that, I mean that everything gets processed. So a large part of wilderness therapy that separates it from outward bound or adventure therapy is that there is a therapeutic component built into it.
And the work is done, from what you say, by mental health professionals.
Mm-hmm.
And maybe we can come back to that. I'm curious about that, but I keep looking at your T-shirt, and I see that it's in Hebrew, and I think it relates to a program that you're interested in Israel that you might want to tell us about.
Yes. Okay, so this program, one component of this program called Nirim in the neighborhood is wilderness therapy. And the way I became involved in this program is that I'm involved in an organization that does site visits to our grantees in Israel. And so we were giving funds to Nirim in the neighborhood, which works with youth at extreme risk who are on the peripheral cities of Israel and have criminal records and are involved in drugs, and they've dropped out of mainstream society. And so Nirim is a program, an outreach program that does case management, but one of the components that really makes their work effective is that they take these youth about 4 times a year out into the wilderness. It could be up north, it could be down in the south, and they have 4 or 5 day called survival missions where the youth are, challenged to do different kinds of activities and exercises.
You said that there's a kind of case management that's involved here.
Mm-hmm.
From the little bit that I know about it, I think that what you mean by that, and correct me if I'm wrong, is that the people who are leading these programs go actually into the community. They connect with the kids in the community, form relationships with them, and begin to build a relationship with them that then gets carried into the wilderness experience. Is that correct?
That is spot on. That's exactly what happens. Exactly what happens. And so the instructors, they're called, who are usually from the elite units of the military. They're former military individuals, men and women. They sort of have transitioned into this role of social workers, although they're not formally trained. They do have trainings by psychologists and social workers. And they work one-on-one with these kids. They go in and work with their families, the school system, the criminal justice system, to sort of function as role models and advocates and mentors to turn these kids' lives around.
So this is way beyond the role of a traditional clinical social worker in doing therapy with kids.
Yes, I think we should be expanding our role.
I'm very interested that it's the military that have taken the lead in Israel in doing this. Obviously, the role of the military in Israel is different from in the United States, but can you comment on that? Is it really important to this program that it's done by the military? And I think that one of the valued outcomes of this program is actually entering the military in Israel.
Right. So in Israel, a very important rite of passage, since it's state-mandated service, is to be able for everyone to do some kind of army service. And the way it works in Israel is that if you don't do army service, it's sort of a disgrace or a shame, and you can't really be fully integrated into society because that seems to be such an important rite of passage. Okay, so when you go for a job interview, you're asked, where did you complete your military service? Now, you don't have to be in the Army. You can also do volunteer work as well. The issue is that the kids that Nirim targets have no chance of going into the military because of their criminal records and their activity and their problematic behavior. So what Nirim does is they get involved early to sort of put these kids on a good path, and their success rate in getting kids into the military or doing volunteer service is about 95%. And some of those youth go on to do really meaningful, service in elite units.
So in the United States, the military is culturally different, shall we say, than it is in Israel. It's not a universal expectation as it is there. It's not considered shameful not to go into the military. So I'm just wondering about the applicability of the Israeli experience to the United States. One question would be, what are the outcomes that the programs try to achieve, since it would be different from having 95% go into the military, and then certain other questions too about.
So that's interesting because, yes, in the United States you don't go to a wilderness therapy program and your goal is to enter the U.S. military, but that. In terms of Israel, the military is the long-term outcome. Being a productive member of society is a long-term outcome. The short-term outcomes in Israel are the same as here, in that you want to get these kids to return to school. You want their behavior issues to be reduced. You want them to have a better sense of self-esteem. You don't want them to be involved in the juvenile justice system anymore. So those are the same.
You said earlier that there's an evidence base for this, and you're a researcher, so I'm sure you're on top of that. But could you talk about what the evidence base is? What kinds of studies have been done? Has a meta-analysis been done? Is this making the list of evidence-based practices on SAMHSA or wherever?
It sure is. I believe on the Cochrane collaboration and Campbell, it shows up. There have been meta-analyses for sure. It has been shown to be impactful in terms of mental health issues, behavioral issues. There is a program actually in New Zealand for youth sex offenders where it's been effective. So there is a lot of literature, and I plan to furnish my audience, if they desire, with a bibliography of studies that show outcomes.
So should they contact you to get that?
They sure can.
And what's your email here at Columbia so that they can reach you if they'd like to?
My email is aw411@columbia.edu, and I'm more than happy to speak with you about wilderness, about the program in Israel, which some of my students actually have gone on, to observe.
Good.
Yeah.
Let me just go back to the difference between this form of therapy and traditional clinical social work. It's striking to me that there is so much outreach, which is one fundamental difference. It's not common for clinical social workers to be doing extensive outreach. They tend to spend more time in this program with the kids that they're involved with. It's not just a clinical session in an office. From what little I know, they tend to be available in times of crisis and take that as something that's very important for them to do. And the relationships appear to be ongoing, so that even after they've finished their course of wilderness therapy, if that's the way to talk about it, kids call their instructors, mentors, therapists, whatever they're called, well after they're not kids anymore, after they've grown up. Is that right?
How did you know that?
I looked at the tape from the Israeli program.
That's spot on, and it's true. Even after um, these participants get out of the military, they maintain a connection with Nirim, and many of them go to become instructors themselves.
So what should we say here in the United States about the way in which we're providing therapy for kids? Should we be doing more of this kind of engagement with kids? More of this sort of non-traditional approach?
That's a loaded question, because on the one hand, I think that you get so much more bang for your buck by doing wilderness. I mean, it's intensive, and you really get to see a person in all their, incarnations. The big problem is that wilderness, at least private pay, is about $500 a day. So until somehow we can make that price much more available to marginalized populations.
Is there insurance coverage for this?
It depends on your insurance.
But there are some
Yes.
Commercial insurance.
Yes.
Medicaid cover it?
Oh, that's a good question.
So that's certainly
know.
something we should look at. I do policy, as you understand, so I
Well-
get very interested in these questions about whether this is something that we should push to have funded.
I think we should write
And
some policy.
Medicaid, of course, is the major funder for mental health services, and particularly for kids at risk. We have some questions coming in.
Well, okay.
You've stimulated an interest here. Somebody, the first question up here is, how do we pursue a career in wilderness therapy? You've got a convert already.
Oh, boy.
So, what do you say?
So this is a great question. There are some programs, certainly out in the West. I know Utah is sort of a big hub for teaching wilderness at some of the universities out there, and it's not necessarily under the title of social work. It could be under psychology or just wilderness, outdoor behavior therapy. So there are programs out there. I believe there are also other programs around the country, and not to create competition for the school, but I know that there is a program, I think, in the Northeast that has a concentration in social work and wilderness therapy.
So I guess this is, if somebody really wants to follow up, they can use your email address and get in touch with you, and maybe you can
Definitely.
guide them along.
Definitely.
And search for programs out there that are preparing people to do this kind of work.
I would just add one thing to that, Michael, which is that I really recommend that you have a wilderness experience on one of these programs before you do it, because I can tell you that my involvement was originally trying to evaluate a program, Nirim, and when I went on the mission to do the evaluation, very quickly my researcher role fell to the wayside, and I began to experience wilderness and really transform myself. So I had to go back a second time to do the evaluation.
Interesting. Next question that's here is, how can we create programs that are accessible and affordable to people with of low socioeconomic status, which we started to talk about. I don't know if you have any thoughts about that.
I believe that there are programs that are government funded, okay, and so they're at a lower cost. I know there are differences whether it's private pay or government funded. I'm not sure what the outcome studies say. I do have a meta-analysis in my office that addresses that, but I do believe that even though it's not so common for low SES participants, there are programs that, focus on.
Well, it sounds from what you say like we really should be working to make this available to low SES kids. We're talking about kids who are at high risk, and certainly there are kids from affluent families who are at risk, but there are a lot of kids who are from the lower socioeconomic status, who are not getting what they need to get. And if this is the kind of engagement and program that they need, we ought to be working at that. We should check and see what Medicaid is doing. And that would be state by state, whether Medicaid is doing it, and also state by state whether the states are deciding to put money into this. Highly unlikely that the federal government, particularly at this point in history, is going to make a decision to put money into anything like this. That's just a personal editorial. There's another question here. This is one question: why don't more U.S. states use the wilderness therapy program instead of punishment-based, as it's evidence-based? I'm misreading the question. I'm sorry. I think this person is saying, since it's evidence-based, why don't more states use it? I don't know if you have any sense of that. I have no idea. If there are some states, it's very few, from what you're saying.
I actually did write down a few programs. There's one in Hawaii, there's one in Michigan and Georgia. I think that it's maybe not well understood, the way sort of the theory of change of wilderness therapy, and it's, you know, it's like anything else new. Maybe states are sort of, you know, weary of it. Or
you commented earlier that this is not outward bound.
Right.
I have this vague sense in the back of my head that there were some issues that came up about outward bound. Am I right about that?
What kind of issues would they
I
have
don't
been?
know. I mean, some questions about the usefulness of it and whether it was punitive or not, and other kinds of questions that I have a vague memory of. So I'm just wondering whether one of the reasons why this is not a program that's supported by state child welfare agencies, state mental health agencies, they're the ones who would have to push this ahead, is that it's confused with other things that.
I think you're right. You're talking about two things. One is that Outward Bound is a really terrific program for sort of self-actualizing and realizing what you're able to do, and gives you a sense of strength. But it doesn't have a therapeutic component. It has wilderness challenges, but there's not that therapy processing piece. That's also considered like adventure therapy as well, which doesn't necessarily have a therapeutic piece. Wilderness therapy, there is group and individual therapy built into it, and it sort of travels with the participants as they go through their activities.
So part of the problem probably is that very few people know what wilderness therapy is.
Right, and they have this
Is there an
image.
advocacy organization? Is there an association of wilderness therapy programs?
There is. It's called the American Experiential Association, the AEA, and they have regional offices and conferences, and then they also have a national conference. I did present at one of the national conferences on Nirim a couple years ago in Portland. So there are opportunities to sort of disseminate this information, but I don't know why it hasn't sort of crossed over and sort of infused more mental health.
So it'd be very interesting to know whether they have an advocacy agenda and what sort of advocacy they have in this. So for the people who are interested in this question of why it's not being used more, you may want to check in with the association, is the AEA, and find out what their advocacy program is, if they have one, and if not, make one for them. Interested in how to evaluate programs? Well, here you go. This is for you. I'd be interested in how to evaluate programs if we are helping a family to consider this option. Oh, so this is really a question not about research, but about the kind of research a family has to do when they're trying to figure out how to help a family member who's in trouble.
Right. So we do know that the evidence is there that these programs are effective. In terms of evaluating a particular program, obviously a number of things to look at. It's very similar interviewing a therapist when you want to go into therapy. You know, you have to feel that there's a good fit between you, your child's issue, and the people providing the care. You have to make sure that it's affordable. You have to look at their philosophy and see, you know, how do they work with kids? It's never punitive, but is this something that you feel your child would buy into? So things like that, the philosophical underpinnings of it.
So there are some tough questions that need to be raised if you're going to get your child involved in any kind of treatment experience.
And it's not a casual decision.
And it's very difficult to sort out and very difficult to get the kind of information that is beyond, yes, this is a licensed program or whatever it is, to really find out how the program works and whether it's for you or for your kid. It's not easy.
And families are typically involved. When you send youth into the wilderness, there's usually a family component, because if you think about it, well, that child is transforming. Ultimately, they're going to go back to their original environment. So the system has to change.
Well, speaking as a grandfather, do you take grandparents on these trips too? I don't know that I could handle it physically.
Oh, we would make sure you could handle it.
Okay.
For sure.
That's interesting. We're going to have time for another 2 questions, one of which is what sparked your initial interest. I thought you said that you had gone there to evaluate the program and you just got captured by it.
I did. It was really serendipitous. We were visiting a program in one of the smaller cities in Israel called Or-Akiva, and the head of this program, Shlomi Avni, he sort of founded the Nirim in the neighborhood. He talked about the work they're doing, and he showed our evaluation team the program. We got to meet with some of the kids, and the concept was totally new to me, and I said to him, I've got to go on your program. I've got to try this. And so I actually went on a mission in December.
Last question. What advice would you give, this question says, an undergraduate college student majoring in social work who would like to pursue a career in wilderness therapy, but let's broaden the question. What advice would you give to any student, particularly a student at Columbia School of Social Work, who has gotten interested from what you've said in wilderness therapy? What advice would you give them about how to pursue a career?
So, again, I think it's 2 things. It's an issue of getting your own personal exposure to wilderness therapy. I know that some programs will sort of like have paraprofessionals join them out in the wilderness. And then, so you're getting exposure and seeing what it's about. And then, you know, find a program. Maybe we'll have a course here at Columbia on wilderness therapy and just get the training and the education.
Okay. So we've reached the end of this session or episode. What are we calling this? A session, an episode, whatever it is. A session or an episode of Social Work Live here at Columbia University School of Social Work. We're glad that you joined us today and hope that you'll come back next week. When we do this again, I want to thank Amy for joining us and being so articulate about the work that you're doing, and I think quite persuasive. So thank you for being here.
Thank you.